So at your very first appointment with your midwife, known as your booking appointment, your midwife will ask you a lot of health questions, social questions and general wellbeing questions. And these are to determine the pathway of care and what care you might require during your pregnancy. Also at this appointment, you will be offered several screening tests that will occur during your pregnancy for conditions that might affect you or your baby's health. It's your decision whether to accept the screening tests or not, and you can certainly take some time to process the information and ask for another appointment to have the screening tests done at a later date if that's what you wish to do. There is a basic outline of the screening tests on the NHS website, and that will be listed at the end of the video for you to view yourself. At your very first appointment with your midwife, you'll be asked to provide a urine sample. Sometimes they can provide you with a clear plastic bottle before your appointment, and they will ask you to provide a sample of your urine from that day and take it along to your appointment with you. They will then send this test away to be tested for something called asymptomatic bacteriuria, which is a urine infection that doesn't have any symptoms. This can be easily treated with antibiotics. You will also be asked to fill in a family origin questionnaire, and this is to determine if your baby might need vaccinating against tuberculosis. So if you or your parents or your grandparents originate in a country that has high rates of tuberculosis, then your baby might require a vaccination at birth, and your midwife can provide you with information about this. You will also be offered several blood tests to determine if you have conditions that might affect yours or your baby's health. Two of these conditions are called sickle cell anemia or thalassemia, and they both are genetic conditions that can be passed on to your baby. So if you're found to be a carrier of these conditions, then your partner will be offered testing as well, just to see if your baby is likely to have these conditions, and then they can talk to you about caring for a baby with these conditions. You'll also be offered testing for 3 infectious blood diseases, which are HIV, syphilis and hepatitis B. If you're tested positive for any of these conditions, then a plan can be put in place to care for you and your baby. These tests are best performed early in pregnancy so that you can discuss treatment options with your healthcare providers. Between 10 and 14 weeks, you will be offered screening for 3 conditions known as Down syndrome, Turner syndrome or Patau syndrome. You can opt for testing for all 3, or you can just have Down syndrome screening, or you can just have Turner's and Patau's screening. All of these conditions are congenital abnormalities, and knowing about these conditions in pregnancy can help you prepare for caring for a baby with these conditions. And you also may choose to end your pregnancy if that's what you wish to do. So you can decline screening at this point, but if you would like screening for all 3 conditions, this must be performed before 14 weeks of pregnancy. This initial test consists of having a scan performed, and the sonographer will take a measurement of the back of your baby's neck, known as the nuchal fold, and they will also take a blood test. The test results do not give a definitive answer as to whether your baby has these conditions or not, but what it does is it does determine whether you're high or low risk. If your baby is deemed to be high risk for these conditions, then you would be offered further diagnostic testing, and it's your decision whether you decline or accept this, and you will receive further information from your midwife or your consultant at the hospital. So between 18 and 20 weeks of pregnancy, you'll be offered an anomaly scan, which is also known as the 20-week scan. And this scan looks at the physical development of your baby. So the sonographer will take measurements from your baby's heart, and lungs and kidneys and brain, and determine if there are any inconsistencies or any anomalies present. If they are, then you would be referred to a consultant for further advice. We have made another video which goes into detail about scans and what that might involve, and there's also information on screening at the end of this video. It is important to note that you can accept or decline screening at any point. You can certainly discuss that with your midwife at the time. If you find blood tests difficult, then you could ask for another appointment on another day, so you can come back and have your blood taken on a different day. And you can purchase numbing cream from a chemist. You put this cream on the area where you're going to have blood taken from at least half an hour before your appointment, and this can numb the skin and make blood tests more comfortable. You can also ask for the most experienced person to take your blood. So most hospitals have a phlebotomist, and they're very experienced in taking blood, but so are midwives as well. So check with your midwife. Around 28 weeks, you will be offered further blood tests, and this is to determine your blood group, your general health, and to see if you have developed physiological anemia. Anemia can be quite normal in pregnancy because you take on extra blood supply during pregnancy, and so sometimes women require iron supplements in pregnancy. Later in pregnancy, your midwife will discuss screening that's available for your baby when they're born, and further information is available at the end of this video. Thank you.